So stick around. What you're about to learn isn't just abstract knowledge. It's practical stuff that could be a true lifesaver. And I promise, it's actually more memorable than you might think. Let's get right into it. Okay, so let's unpack this first crucial point. When it comes to surviving something like a stroke or a heart attack, the very first thing that can, well, make or break your chances is recognizing the warning signs and then acting without hesitation.
Absolutely. And what's fascinating here, or maybe critical, is how vital time truly is. People talk about the golden hour, right?
Hmm.
Every single moment that passes without treatment puts your brain or your heart tissue at risk of irreversible damage. We're talking serious consequences.
And it's so often that people hesitate, don't they? Or they just dismiss mild symptoms to think, oh, it's probably just indigestion, or maybe I'm just tired today.
Yeah, or I pulled something.
Right. But that delay, it can cost precious minutes,
Hmm.
or like you said, even hours.
And those minutes really do make all the difference. Consider someone like James, I read about him, a 73-year-old retired teacher. He felt the sudden numbness in his face, weakness in one arm, just while reading his morning paper. Now, he could have shrugged it off
Easily done.
very easily, but instead he immediately dialed emergency services. And that quick action, it made all the difference. He got treated early, made a remarkable recovery.
That's amazing. So what does this mean for recognizing signs? For a stroke, we're looking for things like sudden confusion, right? Trouble speaking or understanding speech.
Exactly. Along with that numbness or weakness, often just on one side of the body.
And a heart attack often starts with chest discomfort, maybe shortness of breath.
Yeah, or cold sweats, nausea, even sudden dizziness. It's not always the dramatic clutching the chest scene we see in movies.
That raises a really important question.
Yeah.
Why do so many people overlook these signs? Is it just denial?
Often, yes. Fear and denial play a huge role. They can cloud judgment. There's also sometimes embarrassment. People feel silly calling for help if it turns out to be nothing.
The bothering people feeling.
Precisely. But the truth is, acting fast saves lives. Emergency services want you to call. It's never, ever a bother to seek immediate help. Learning to trust your body, to respond decisively, that's really a form of self-respect, self-care.
So the first big life-saving tip is really about education. Know these symptoms, yes, but also prepare yourself mentally to act immediately. Don't ignore what your body is telling you.
Keep emergency numbers handy. Maybe consider a medical alert device if you live alone or have risk factors. It's not just knowledge, it's adopting a kind of survival mindset.
Absolutely. Okay, so if you're finding these insights valuable, maybe take a moment right now, let us know you're here, perhaps leave a comment below with tip 1 or your biggest takeaway so far. And if you haven't subscribed yet, we'd really appreciate it if you did. Maybe turn on the bell too so you don't miss future deep dives. Your support genuinely helps us keep creating this kind of content. Right, moving on. Here's where it gets really interesting, I think. When you find yourself alone during a stroke or heart attack, that sense of isolation, it must feel overwhelming.
It certainly can, but it's so critical to remember, even in that moment, you are not powerless.
Yeah.
There are practical, life-saving techniques you might be able to apply right away, things to potentially protect your heart and brain while you're waiting for help.
Like what, specifically?
Well, one thing sometimes mentioned, though it needs careful context, is the self-administered cough CPR method.
Cough CPR, how does that work? Is it, like, widely recommended?
Okay, important caveat here. Calling 911 or your local emergency number is always the absolute first priority. Nothing replaces professional medical care.
Right, got it.
Cough CPR isn't a substitute, and its effectiveness, especially for self-administration, is debated in the medical community. But some sources describe it as something you could try, perhaps as a last resort while you're on the phone with emergency services, especially if you feel like you might pass out.
So what's the theory behind it?
The idea is that coughing forcefully and repeatedly, maybe every couple of seconds, increases the pressure inside your chest. This can help squeeze the heart and maintain some blood flow and oxygen circulation temporarily. It might buy crucial time if your heart rhythm is seriously disrupted.
I remember hearing about Helen, a 78-year-old grandmother. She apparently faced a sudden heart attack one afternoon, alone. She recalled hearing about this cough technique at a health seminar. So while she was dialing 911, she started coughing forcefully. And apparently that steady action helped keep her conscious until the paramedics arrived.
Yeah, and Helen's experience, while anecdotal, is a powerful example of how applying some kind of knowledge, even if it's a debated last resort, can give you a sense of control. It might help physiologically, and it definitely helps psychologically against panic. Alongside that, simple breathing exercises, focusing on deep, slow breaths. That can help calm the panic response.
How does that work physiologically?
Deep, slow breathing can actually help stimulate the vagus nerve, which activates the parasympathetic nervous system, the rest and digest system. This can help lower your heart rate, lower blood pressure, and reduce the strain on a heart that's already struggling. It also improves oxygen saturation.
So it's not just calming down, it actually helps the body cope.
Exactly. But many people hesitate, right? They worry about doing the wrong thing.
Yeah, definitely. The fear of making it worse.
But honestly, in these situations, the risk of doing nothing usually far outweighs the risk of trying something simple like controlled breathing, or in specific circumstances, that cough technique while help is en route. Practicing these things when you're not in crisis can help make them feel more automatic.
Like building muscle memory for an emergency. Helen's story shows that right.
Yeah.
When panic could have just taken over, she stayed calm enough to act.
Precisely. So tip 2 is about equipping yourself with these practical self-help techniques, understanding their context, and preparing mentally to use them if needed. That preparation could genuinely increase your chances.
Okay, let's move forward. Tip 3. This feels related to the first point, but maybe digs a bit deeper, recognizing those early warning signs.
Yes, and trusting your instincts about them. This is a huge challenge, particularly for older adults when they're alone. It's so easy to ignore subtle symptoms or attribute them to just aging or maybe another chronic condition you already have. But that delay, as we said, can be fatal.
So knowing what to look for and really trusting your gut feeling when something feels wrong, that's key.
It can be the difference between getting help immediately and, well, a tragic outcome.
There was another story, Carl, a 75-year-old. He felt this mild but kind of unusual discomfort in his chest one morning. Nothing dramatic.
Easy to ignore.
Totally. But instead of brushing it off, Carl remembered reading about listening to your body. He decided to act quickly.
Good for Carl. What were the early signs again, just to recap?
For heart attack, it could be that chest pressure, shortness of breath, maybe sudden weakness, a cold sweat, nausea.
Right. And for stroke, sudden numbness or weakness, face, arm, or leg, especially on one side, or sudden confusion, trouble speaking, seeing, or that sudden severe headache. And these might come and go initially.
Fleeting symptoms. That makes it even harder.
Exactly. Ignoring them is dangerous. So Carl felt that mild tightness, a bit of dizziness. What did he do?
He didn't panic. He sat down immediately, focused on steady breathing, and crucially reached for his phone and called emergency services.
That's the textbook response. And what's really fascinating here is recognizing that these signs aren't just about the physical feeling, but understanding what's normal for you. Many seniors live with chronic conditions, arthritis, diabetes, lung issues that can sometimes mask or confuse these warning signals. That's why awareness and education are just so vital.
So Carl's prior awareness empowered him.
Absolutely. It helped him overcome potential denial or fear. Psychologically, when you can kind of name what might be happening even tentatively, you move from confusion towards action.
That makes sense. It reduces the paralysis of fear.
And it raises another point. Should you share this knowledge? Definitely. Talk to family, friends, neighbors. The more people around you who know the signs, the better the chance someone might notice if you suddenly can't call for help yourself.
But ultimately, the responsibility starts with you knowing your own body.
Yes. So, the third life-saving tip. Educate yourself deeply on those early warning signs and cultivate the instinct to trust your body and act fast. Don't second-guess yourself into a dangerous delay.
Now, tip 4. This also feels really practical. When a heart attack or stroke strikes, and you're alone, the way you position your body and control your breathing, you're saying that can actually influence survival chances.
Dramatically, yes. It's not just about passively waiting for the ambulance. Your immediate actions can potentially ease symptoms, improve oxygen flow, and crucially, reduce the physical and mental stress on your system.
So it's about actively supporting your body while waiting.
Exactly. This is why knowing how to position yourself and using those breathing techniques we touched on is really essential knowledge.
Let's bring Helen back again. We talked about her cough CPR attempt during a heart attack. But you mentioned another instance, a mild stroke while she was alone.
Yes. Imagine she felt that sudden weakness on one side. Scary situation. But she remembered advice, maybe from a health talk. She didn't lie down flat. She sat down, leaned slightly forward, rested her elbows on her knees, kind of a tripod position.
Okay. Why that position?
Leaning forward like that can help open up the chest cavity slightly, takes pressure off the lungs and heart, making breathing easier. It can reduce strain. Lying flat, especially on your back, can sometimes make shortness of breath
Right,
worse.
and she combined this with the breathing.
Yes, slow, deliberate breaths. This simple combination, the position and the breathing, helped her breathe easier, reduced her dizziness, and crucially helped her stay calm until help arrived.
So sitting upright or slightly forward is generally better if you're conscious and having trouble breathing.
Generally, yes, for cardiac or stroke emergencies where breathing is difficult. If you feel really dizzy or lightheaded, definitely sit or lie down to prevent a fall. But try to avoid lying flat on your back unless you absolutely have to. That forward lean or upright posture is often best for respiratory effort.
And the breathing itself, reinforcing that point, maintaining oxygen, calming the nervous system.
It's fundamental. Deep, slow breaths combat that panic response. Panic ramps up heart rate, blood pressure, oxygen demand, all things you don't want in this situation.
That technique Helen used, breathing in slowly through the nose, holding briefly, exhaling slowly through pursed lips.
Pursed lip breathing, yes, it's excellent. It helps keep airways open longer during exhalation, getting rid of stale air and allowing for better oxygen intake on the next breath. And the psychological benefit is huge. Focusing on something physical like your breath gives you an anchor, a sense of control.
It breaks the panic cycle.
It can, yes. So,
Especially true for seniors, you mentioned, whose symptoms might be subtle or atypical.
yes, or easily mistaken for something less serious.
I read about Robert, a 72-year-old man. He experienced this unusual fatigue and just mild chest discomfort one morning, home alone.
Again, easy to dismiss, just tired, slept funny.
Exactly. But instead of brushing it off, Robert remembered the importance of early recognition. He called emergency services right away. And because he acted so quickly, doctors were able to give him treatment, maybe clot-busting drugs, or an intervention that minimized heart damage. Saved his life.
Robert's story perfectly illustrates why this recognition is so vital. Treatments like thrombolytics for stroke or procedures like angioplasty for heart attack are incredibly time-sensitive,
The golden hour again.
or even shorter windows for some treatments. They are most effective when given quickly, often within the first few hours, sometimes even the first hour of symptoms starting. Every single minute counts. Delaying care increases the risk of permanent damage, disability, or worse.
The challenge, as we've discussed, is that seniors might dismiss symptoms. Oh, it's just my age, or it's probably my indigestion again. That mindset can be truly deadly.
It really can. And for seniors living alone, having a clear plan for what to do when symptoms arise is critical.
What does that plan look like?
Having emergency numbers easily accessible may be programmed on speed dial, written large near the phone, knowing your address clearly, being able to describe your symptoms simply and clearly to the dispatcher. Maybe even having a system with a neighbor or friend, a check-in call, or alerting them if you feel unwell.
Being proactive to speed up the response.
Exactly, because psychologically, that fear and denial we talked about, they're major roadblocks. Feeling embarrassed, reluctant to call for help, hoping it will just pass. These feelings put your health at immense risk.
It's about reframing asking for help.
Absolutely. Accepting that calling for help is a sign of strength, of taking control, not weakness. That's crucial for survival. Training yourself, talking with loved ones about the signs, regular checkups, open conversations with your doctor, all of this empowers you to take control when it matters most.
Robert's experience is such a clear reminder. Knowing the signs, trusting your gut, and responding immediately can protect your health, maybe even extend your life. It's not just about avoiding panic, but understanding what your body might be telling you and acting swiftly. Prepare yourself to be decisive. So what does this all really mean for you, listening right now? We've gone through these 5 life-saving tips. It feels incredibly clear just how crucial preparation is, doesn't it? Especially when facing something like a heart attack or stroke alone. None of us wants to imagine being in that vulnerable situation. But the reality is, it can happen. To anyone.
That's absolutely right. And that's why knowing what to do, immediately recognizing those subtle symptoms, staying calm enough to call 911, using those self-help techniques like positioning and breathing it, isn't just important information. It feels essential. And you might be sitting there thinking, oh, I'm pretty healthy, or I have family nearby, I'll be fine. And that hope is natural, of course it is. But life throws curveballs. Sometimes help isn't right there, right when you need it most.
So preparing yourself with this knowledge, these practical steps, it feels like the best way to protect your independence and ultimately your life. It's about empowerment, really. We really encourage you now, take a moment, Share what you've learned from this deep dive. Maybe leave a comment below telling us which tip resonated most with you, or perhaps how you plan to use this knowledge. Maybe share it with someone. Your experiences, your thoughts, they're important. They help build a supportive community where we can all empower each other.
And if this deep dive was helpful, please do consider liking it, subscribing if you haven't, and maybe sharing it with others who might benefit. Your support genuinely motivates us to keep creating content that aims to inform, uplift, and hopefully inspire.
Thank you so much for joining us today. Stay safe out there, stay informed, and please remember, you have more power than you think to protect your life, even in the toughest moments. We look forward to diving deep with you again soon.